Welcome back to Every Woman, and we have Dr. Justin West from BreastLink here. Thank you so much for coming back and telling us more. Now, we are talking about breast cancer surgery and reconstruction of the breast, and you've brought in some breast implants for us. Can you tell us a little bit about the differences about these and
Sure.
why someone would choose breast implants versus using their own tissue?
Sure. Well, to start with, I'll explain what we're looking at here. After a mastectomy, the breast tissue gets removed, and what we have left is skin and muscle. What we have to do is actually stretch that skin back out. So if somebody comes in with a C-cup breast and they lose a fair amount of skin and they want to stay a C-cup breast, we have to stretch that skin back out to accommodate an implant. So we start off with this device called an expander, which is basically just a balloon with a port. What we do is we lift up the muscle and put the expander under the muscle, and then we close the skin over that. We put a little needle through, and then we start to inflate that expander. We start actually in the operating room, putting a little bit of volume in there, and then the patient gets discharged, and then they come in the office every 1 or 2 or 3 weeks to get filled. So each time the patient leaves the office, they're a little bit fuller, and people always ask, well, what size should I be, and when am I done? What I usually tell them is, you'll come in one day while we're expanding you, and you'll say, you know what, I like the way I fit my clothes. Or when I get out of the shower and look in the mirror, that's the size I want to be. It could be the size you are now, smaller, you could be bigger. I wait until they tell me this is what I like. Then when they're done expanding, we take them back for a second surgery. It's an outpatient surgery. It's very straightforward. We remove this and we add an implant. So what you're looking at here are two examples of different types of silicone implants. This is a round implant, and then what you can see here is a shaped implant. So the shaped implant mimics a little bit better how a woman's breast is shaped, and it was sort of a teardrop look. This is a more traditional implant, which you can get outstanding results with as well. But these are the two devices that we use most frequently.
I don't mind them being a little perkier,
You will, if you want to pass these and compare those. But a woman's breast that's reconstructed with an implant generally will have a perkier, sort of more youthful look. Some people want that, some people don't. Some people are looking for a more natural look. So we talked a little earlier about other options. Some people look at this and say, wow, 2 surgeries, silicone, foreign body, I don't think I want to do that. Some people have religious preferences that don't allow them to place implants. And for other reasons, it's just a personal dislike of implants. So we talk about using your own body tissue. So if you have a little bit of belly tissue, a little extra that you might want to have removed, for, let's say, in the form of a tummy tuck, we can take that tissue and move it up to the breast and build a breast. We can also use back skin and muscle to build a breast. We use buttocks and inner thighs to build a breast. So there's a lot of options. The options are going to be, not everybody's a candidate for each of these options. But in a consultation, we go over sort of A to Z what a woman's options are, and then we try to tailor the plan that best fits what ultimately the woman wants and then what she's best built for.
So if I've had breast cancer, is it better to get, like, say, lean or silicone? Does that have any effect, or does it matter?
So the question of saline versus silicone comes up in our office every day, whether it's cosmetic reasons or for reconstruction. Mm-hmm. Silicone implants, we had a moratorium. The FDA held them, or in 1992, we really stopped using them extensively. In 2006, the FDA reconvened and they talked about the silicone safety issue. What they found was this panel of experts who looked at every study that had been done on silicone implants, so that the overwhelming data shows that they are safe, which is why they voted to let them back on the market. So around 2006, 2007, we saw them enter the market again.
Now, why was that important? Why did they want them?
Well, the concerns that came up in the 80s and 90s were people were getting, finding lumps, they were getting, they were discovering connective tissue diseases that they thought might be related to the implants. You know, the implants in the 70s, 80s hadn't been out long enough to really understand what are the long-term complications. You know, the first implant was around 1964, and sometimes it takes a while from the time you put something inside somebody or treat somebody with medication till you see the long-term effects. So people started developing connective tissue disease and thought, well, could they be related? Without any evidence, the FDA voluntarily said, well, we're going to take them off the market and study this extensively. What they found after that, between 1992 and 2006, 14 years of study, one of the biggest studies that's ever been done on a medical device, is that they are safe, which is why they're back on the market now.
So now that we know that they're safe, I have a question. I'm kind of scared to ask, but do they feel the same? Am I going to get the same amount of pleasure or... You know, they're going to look good, but are they going to feel good?
Right.
That's an important question. Don't be scared about
that. It's a question that comes up every day.
You can still breastfeed, too.
So we were talking about a couple of different issues. And we were talking about the setting of a reconstruction. You know, one of the advances that we're doing, that we've come up with recently in reconstruction, is that a traditional mastectomy involved removing a woman's nipple as well as part of the other skin when doing the mastectomy. That was standard. These days, we look at each woman individually. There are times where we can actually preserve the nipple and keep it on the breast. In those settings, you have the nipple appearance, right? It's still there, but you won't have any sensation. The mastectomy takes away that nerve supply. Now, some people get some sensation back, but most don't. So we may reconstruct you so that you look whole, but you'll have significantly diminished sensation. I usually counsel my patients that expect that you won't have anything that you have is sort of a bonus.
Well, Dr. West, now you work with your father, who is also with the practice. You know, he basically takes out the cancer, and you make the woman whole again. Why did you choose this profession? Was this something that your dad trained you to do, to be a breast doctor?
Yeah, I grew up in an unusual household with a very with an enthusiastic father who really loves educating. I actually did my first procedure when I was about 5.
Wow.
I took off a mole on my father's scalp when I was about 5 years old.
Family bonding.
I didn't bill him for it. When I was about 12, I started actually scrubbing into the operating room and assisting in cases. So it's an unusual childhood.
Wow.
So I was in the operating room before I drove a car.
How great that he brought you in and it's such a
Yeah, it was a pretty exciting childhood.
Yeah,
so I got to do
bet.
things that a lot of kids don't get to do. And I was doing things that medical students didn't get to do at a very early age. When I was in high school, I got involved in a research project at UCI putting rabbits on bypass systems. So I was doing little heart bypass surgeries as an 18 to 20-year-old. So then I got to medical school thinking, you know, my father is very passionate about what he does. You know, he does this great thing for women, takes out this cancer so that they can live longer. And I thought, you know, I'm going to do that too. I saw my first reconstruction as a medical student. I thought, you know what? I relate to this. Putting someone back together made sense to me.
Yeah.
So I chose to go off in that direction.
Wow.
I just love the
Yeah.
whole team approach. You guys have such great enthusiasm and passion for your work, and everybody has a niche, and it just is a complete, you know, all put together, ready to go.
Well,
You feel
thank you
good.
so much for joining us and telling us all about this. You can get more information on Dr. Justin West, plastic surgery and breast cancer awareness at breastlink.com.